Hi, my name is Kayla Akano, and for my presentation, I did medical research on allergies and a little bit about late developed allergies. So, what are allergies and how are they caused? Allergies occur when your immune system reacts to a foreign substance such as pollen, animals, food, and other triggers. And so, your immune system starts to overreact by producing antibodies that attack the allergen, which then causes symptoms. And so some common symptoms can be sneezing, itchy or watery eyes, runny nose, rashes, or fatigue. So some long-term effects on allergies is that it can slowly weaken your immune system and it can set you up for bacterial or fungal infections in your sinuses, lungs, ears, or skin. And for short term, it's just going to be the classic allergic reactions. So again, just sneezing, runny nose, watery eyes, and just those symptoms. So, I'm going to be talking a little bit about late developed allergies and why it happens. So, late developed allergies, basically what it says in the name, it's when you randomly have an allergy to something you haven't been allergic to before. And so, experts think that puberty, pregnancy, transient or chronic illnesses, or organ transplants disrupt your immune system, and that can change your allergic responses to things you haven't been allergic to before. And so there was a survey on 53,000 people here in the United States, and their study found that 45% of those who had food allergies developed at least one new food allergy in their adulthood. And of that group, a quarter never experienced food allergies as children. And so there wasn't really a reasoning behind this. They couldn't find a reason. So basically, there's just no reason behind late onset allergies. Kind of just random and just can happen anytime. Some treatment for allergies is obviously taking pills. So Claritin, Zyrtec, and just that type of medications. An obvious one is avoiding the allergy. You can also do immunotherapy, which is just allergy shots, and nasal sprays. So I'm going to talk a little bit about immunotherapy. It's used to reduce symptoms and allergy attacks. There's two phases, and so the first phase is the build-up phase. The timeline for that is 3 to 6 months. The shot is given to you at least 1 to 3 times a week, and the allergen dose is increased with each shot. The next one is going to be the maintenance phase, and that continues for 3 to 5 plus years. And that shot is going to be given to you once a month, and so your allergy symptoms should be improved during the first year of treatment, but it's mostly noticeable during the second year. And then after that, you're just like brand new. I mean, obviously not brand new, but somewhat brand new. And so if you ever have an allergy suspicion, you can do three of these common tests. This first one is the skin prick test. The second one is the intradermal skin test, and the last one is the patch test. The skin prick test is the most common one, and the doctor will basically just place small amounts of allergens on the skin. After that, the skin is pricked, so the allergen goes under the skin. And after that, the doctor will just observe the skin for any swelling or other signs of a reaction. And the results are usually seen within 15 to 20 minutes. And so you can see in that picture how it's done and what you're really looking for a reaction. And the next one is going to be the intradermal skin test. It's very similar to the prick test, but instead they just inject a small amount of allergen into the skin, and after that, the doctor will observe for any reactions. And this test is usually to see if you're allergic to bee venom or penicillin, or if the skin prick test was negative, but there's still an allergy suspected. The last one is the patch test. So basically, what they do here is they put the possible allergy taped to your skin for 48 hours. After that, the doctor will look at the area in 72 to 96 hours and then just see if there's any reactions or anything like that. So, some things to look out for during these tests and after the test is that for the skin prick test, there's going to be a mild discomfort when the skin is pricked. And if you have a reaction to any of the allergens, um, you're gonna have symptoms like itching, stuffy nose, watery eyes, or skin rash. So basically, just any allergic reactions. And then for the intradermal skin test, there can be a life-threatening reaction named anaphylaxis, and anaphylaxis occurs when you're exposed to a substance. In this case, it would be bee venom. And so after that, your immune system becomes extremely sensitive to it. And so some symptoms to this reaction could be abdominal pain, difficulty breathing or swallowing, slurred speech, unconsciousness, nausea, anxiety, redness of skin, or swelling of the face. And there's many other symptoms, but these are just the most common ones. And again, like I said before, it's a life-threatening reaction, so if this ever occurs, you might want to call 911. And the next one is gonna be the patch test. This one isn't that crazy like the intradermal skin test. For this one, you're just gonna feel irritation, or itchiness, but the symptoms will go away right after the patch is removed. And so yeah, thank you.